Keeping strong bones until old age is crucial. A hip fracture might be the reason you will have to live in a nursing home, and it might take years of your life. Osteoporosis is more common than you might think. About 1 in 3 women and 1 in 5 men over 50 will experience osteoporotic fractures in their lifetime. Let's see what we can do about that. Weakened bones. Our bones are constantly broken down and rebuilt. If this balance is broken, we will suffer from bone loss over time. Osteoporosis is a silent disease until the first fracture occurs. So before you start any new strenuous physical activity, please talk with your doctor. If you are a post-menopausal woman, testing for osteoporosis might be a good idea. There are various diseases and genetic disorders that affect bone health. Still, there are quite a few diet and lifestyle factors, including preventable chronic diseases. Some are even reversible, and every step towards better bone health helps. Chronic diseases. Why not kill 2 birds with 1 stone? Or rather, feed 2 birds with 1 scone, and prevent chronic diseases and thereby improve your bone health at the same time. Bone health is impaired by type 2 diabetes, chronic kidney disease, chronic metabolic acidosis, and excess visceral fat. These conditions can be prevented and some even reversed by diet and lifestyle modifications. Check out our videos on type 2 diabetes, chronic kidney disease, and weight loss linked in the description. Weight and bone health. Unhealthy, inflamed visceral fat is bad for our bones. But in general, weighing more is in fact protecting our bones. There are various effects at play. The extra weight is putting a strain on our bones, which makes them stronger. The extra fat can act as a cushion when falling. And fat cells produce estrogen, which promotes bone health. Now, if we talk about excess fat and excess hormones, we need to look at the risks and benefits. How many fractures are prevented versus how many extra heart attacks, cases of type 2 diabetes, of cancer, and death, etc. These risks are not worth it, especially if there are other ways to keep our bones healthy. Still, excessive thinness is a risk factor for osteoporosis. Exercise for bone health. Being slim has many health advantages. But the missing strain on the bones can be a problem for bone health. Exercise can help, especially resistance training. And you should of course also exercise when you are overweight, within your limits. Weight loss can lead to bone loss due to reduced strain on the bones. Exercise helps preserve bone and muscle mass. Please consult your doctor about any drastic changes in your exercise routine. Calcium supplements. Calcium deficiency can lead to bone loss. Should we take a calcium supplement to ensure we get enough on a daily basis? No. Calcium supplements can indeed increase bone mineral density, but this advantage seems to disappear after a few years. At the same time, they increase the risk for heart attacks and strokes. If 1,000 people took calcium supplements for 10 years, there would be about 26 fewer fractures, but 14 additional heart attacks, 10 strokes, and 13 additional deaths. If not prescribed by your doctor, please do not take calcium supplements. Make sure you get between 500 and 1000 milligrams of calcium from dietary sources on a daily basis. For example, from green leafy vegetables, legumes, and tofu. Dairy and bone health. Milk does not promote bone health. Studies have shown that milk consumption has no effect on the fracture risk in men, and it even increased the fracture risk in women, while increasing mortality risk in both. This might be caused by galactose, which is part of the disaccharide lactose. Galactose needs to be detoxified by our bodies. Fermented dairy products containing much less galactose do not seem to have this negative effect on our bones. Foods for bone health. Now we know that dairy products are not really promoting good bone health, but there are some foods that seem to help our bones. First of all, it is important to avoid oxidative stress, which is shown to accelerate bone loss. So eating lots of antioxidant-rich whole plant foods is a good idea. Foods that seem to be especially good for our bones are legumes, almonds and prunes. The phytates in whole grains, legumes and nuts, falsely categorized as anti-nutrients in the past, are linked to higher bone mineral density across the board. They do seem to inhibit mineral absorption for a limited time frame until the body has accustomed itself to the higher phytate intake. Phytates also act as antioxidants and exhibit anti-carcinogenic properties. They can be considered an essential nutrient. Vitamins for bone health. The most important vitamins for bone health are vitamin D and vitamin K. Vitamin D is responsible for managing calcium absorption and distribution in our body. A vitamin D deficiency can negatively impact our bone health. Check out our video on vitamin D if you want to know more about how to cover this essential vitamin. Vitamin K comes in two forms, K1 and K2. There is no known difference in their biological function, so there is no need to differentiate between them. Plant-based vitamin K-rich foods are cruciferous vegetables like kale and broccoli, and chickpeas. Thanks for watching our video. Please share this video with your friends and family. See you next week!